Hi everyone, my name is Peter. Welcome to this YouTube tutorial. In this section, we are going to be looking at the pharmacology and we are continuing with the anti-seizure drugs. And today's drug of choice we are going to talk about is Topiramate, or also known as Topamax. In this section, we are going to look at the mechanism of action of this drug, the pharmacokinetics, and then some of the side effects seen with this drug. So therefore, to jump into the topic, let us begin with the mechanism of action of this drug. We know that in seizures, when somebody is having a seizure, usually it's the repetitive firing of the neurons in the brain. So this leads to the uncontrolled movements. It can involve the muscles, can be like absent seizures, and usually it's due to the leakage or the excessive firing of nerve impulses in the brain. And sodium is one of the main important ion that initiates or that helps in the propagation of these impulses. So therefore, the mechanism of action of this drug is topiramate is going to block the sodium channels. So when these sodium channels are blocked, so no more firing will be seen as it is in the status epilepticus or during seizures. So therefore, this drug is very good in managing partial seizures and also some of the genotonic chronic seizures. It is also said that topiramate can bind to what we call the glutamate receptors, which are the AMPA receptors. So AMPA receptors, this is the L-alpha amino 3 hydroxyl 5 methyl 4 isoxazole propionic acid receptors. That's what AMPA means. So therefore, this when topiramate binds to these receptors, you know that glutamate is an excitatory receptor. So when somebody is having a seizure, there is excitation of these neurons, these cells. So and glutamate is the neurotransmitter that leads to the excitation. So therefore, when topiramate binds to these receptors, it is going to block glutamate from binding of these receptors. So therefore, we shall not see the repetitive firing seen in seizures. So therefore, these are the two proposed mechanisms of action of topiramate. So therefore, to jump into the pharmacokinetics of this drug, to begin with absorption, so topiramate is well absorbed. Actually, it has an absorption of about 90 to 95% oral absorption, and bioavailability. And in this distribution, this drug is really has a low protein binding capacity, low protein binding. And above here, I have the structure of topiramate. You can see that it's a derivative of a monosaccharide. So topiramate is a sulfamate monosaccharide. It's derived from the structure of fructose. So to jump into the metabolism of this drug is metabolized in the liver with the cytochrome P453 F4 isoenzymes. So these isoenzymes are so common, as if you've been following my YouTube tutorials about the anti-seizure drugs I've been discussing, this is the prime isoenzymes that metabolize most of the anti-seizure drugs I've discussed. So therefore, when you give this drug together with another anti-seizure like carbamazepine, phenytoin, and phenobarbital, this drug is going to be eliminated more, or it's going to be metabolized more than the other anti-seizure drugs because they induce this enzyme. So if this enzyme metabolizes topiramate, so therefore when you give it together with a phenobarbital or phenytoin or carbamazepine, we are going to see a reduction in the concentration of this drug in blood, and therefore it's better to do a drug adjustment when you're given this drug together with other anti-seizure drugs that induce this type of isoenzyme. And also the elimination of this drug usually is eliminated in urine. And if you do not have the cytochrome 3p450 with this isoenzyme of 3A4, usually this drug can be eliminated unchanged, like 40 to 45% in absence of the other anti-seizure drugs that can quicken its metabolism. So, and another thing you have to note about this drug that it's a sulfur drug, so therefore most of the sulfur drugs tend to cause kidney stones in the kidney, so therefore it's better to tell a patient to take a lot of fluids. Take a lot of fluids, or take a lot of water when you're taking this drug. Basically, that's the pharmacokinetics of this drug. So let us further jump into the side effects of this drug. So we shall see that since this drug is can cross the brain barrier, so most of the side effects we're going to see are centrally located. So the first one is somnolence or excessive sleepiness. So there is excessive sleepiness when you take this drug, and also there is dizziness and drowsiness, and also we shall see there's a problem in speech, slurred speech, and what you have to note is that this drug is a sulfur drug, so therefore it's very better, it's contraindicated with patients that that are allergic to sulfur. So therefore, basically that's all I had for you as far as Topiramate is concerned. So therefore, thank you very much. See you next time as we discuss more anti-seizure drugs. Bye for now.